Hello doctors. In the series of videos for Casper, we are now going to be sharing with you multiple videos that will help us all understand about inhalation therapy. Inhalation therapy is the mainstay of treatment for asthma. I'm sure all of us believe this and know this. But there are still some challenges that we face when it comes to convincing parents about inhalation therapy, convincing parents to accept inhalation therapy. There are various myths and misconceptions associated with it. And in this first video in the series, I'm going to help you all understand about how to convince parents for inhalation therapy. Some key messages that we need to give to our patients are that inhalation therapy is not the last resort for treatment of asthma. Very often they will come and tell you, doctor, please try some tablets, please try syrups. We are also okay to come twice a day to get our child nebulized, but please don't start inhalers. If nothing works, then we will think about inhalers. But please do make them understand that inhalation therapy is not the last resort. It is the mainstay of treatment for asthma. Inhalers should be started for the child the moment we suspect the child to have asthma. And when we are doing the live session of Casper about diagnosis and management, you will realize that inhalers are not only an important aspect of management, but they also play a key role when it comes to diagnosis of asthma in the form of trial of ICS therapy. Inhalation therapy is the safest, fastest and most effective form of treatment of asthma, and this has been endorsed by all international guidelines for diagnosis and management of asthma. Inhalation therapy is the safest, fastest and most effective therapy. And why is it so? Now this information many of us have, but how do we convey it to the patients? Let us understand that. We have to compare what happens when we take a medication orally versus when we take a medication through inhalation therapy. When we give a medication orally, the dose first of all is very high. It is in a few milligrams. What we should ideally do is keep a tablet of salbutamol, 2 milligrams, or keep a syrup of salbutamol which would have 2 or 2.5 milligrams per 5 ml, and show it to the parents that look here, this has got dose in milligrams and 1 milligram comprises 1000 microgram. Secondly, when we give this high dose orally, it goes into the stomach, it goes into the intestines, from where it is absorbed into the blood circulation. Through the blood, it reaches each and every part of the body. It reaches the brain, it reaches the heart, it reaches the bones, everywhere. And a small part of it, a minuscule part of it, reaches the lungs where its effect is required. Now, by virtue of the fact that it is reaching the lungs after a huge delay, the effect takes place after a delay of about 4 to 6 hours. Secondly, because it is reaching all places where it is not required as well, the side effects are very high. It gives the child palpitations, it gives the child tremors, it makes the child irritable. All these side effects are associated with the medication given orally. What happens when we are giving the inhaled medication? First of all, the minuscule dose that reaches the lungs after we have given the tablet orally, we are giving that dose directly into the lungs. So the dose is small and it is reaching directly into the lungs. It is not reaching anywhere else in the body. It's not reaching the brain, heart, bones, kidney, nowhere. It is going to take effect only in the lungs. So the effect is seen within minutes, and there are no side effects associated with inhaled medication if given in the correct dose and given with the correct technique. So this is how we need to explain to the patients. It is as simple as giving localized target therapy. For example, if there is an abrasion or an injury on the skin, we give the patient a local ointment to apply. For conjunctivitis, we instill eye drops. Similarly, we are very lucky that for the lungs we have direct access through the oropharyngeal cavity, and we can give medications directly where it is required without it going anywhere else in the body. So it's localized on target therapy, and that's why it is the safest, most effective and the fastest acting. Patients will often ask, or they will believe, that inhalers are addictive. I'm sure you all will agree with me when I say that this statement is a false statement. Inhalers are not addictive. Now, telling a patient that inhalers are not addictive is not going to suffice. We have to back it up with an explanation. And how do we explain to our patients that inhalers are not addictive? Anything that affects the brain can cause addiction. Do inhalers reach the brain? No, they are reaching the lungs. So how can they cause addiction? It is like wearing spectacles. If a person wears spectacles, do we say that the person is addicted to spectacles? No. Wearing spectacles helps him see things clearly. But if the person does not wear spectacles, it can lead to worsening of eyesight. Similarly, we brush twice a day, hopefully twice a day, but at least once a day we brush. It helps keep our teeth clean and healthy. If we don't brush, our teeth will undergo decay. Similarly, when we are using an inhaler, we are just taking care of the inflammation that is there in the airways and keeping the airways in a non-inflamed condition. If you have seen the video on pathogenesis, I'm sure you will recollect that using inhaled corticosteroids and keeping the inflammation in control is going to help control symptoms, and in long term it may also help prevent airways remodeling. Though the literature says otherwise, but at least the current symptoms are controlled. So it's very important to keep the inflammation away by using inhalers regularly. What are the available inhalation devices? There are a lot of inhaler devices available. There are pressurized metered inhalers, dry powder inhalers, different types of dry powder inhalers. There are breath actuated inhalers and nebulizers. I'm going to be separately sharing videos on each of the different type of inhaler device. But what is important for us to know is that we should know the correct technique of using the inhaler. This is very important. Secondly, we should also teach the parents how to use the inhaler devices correctly. If we don't teach the technique, the parents are not going to know what to do with the device. So it's very important that we spend time teaching. Parents often forget how to use the inhaler devices and they do a lot of mistakes. They commit a lot of mistakes. So it's important that every time they bring the child to us for review, we should check the technique with which the parents are giving the inhaler to the children. And for older children, of course, we check how the children are doing, because each step is important, as you will realize in the subsequent videos. So very importantly, check the correct technique of using the inhaler device. Proper maintenance of the devices is also important. Proper replacement is also important, and we will discuss all this in the subsequent videos. Thank you all very much. Do look forward to the next videos on MDIs, MDI and spacers, dry powder inhalers and breath actuated inhalers. Thank you.